So many parents today want to take the more natural, less invasive route when it comes to helping their children with their health. And this is especially true when it comes to ear infections. While common recommendations may include antibiotics, and if multiple rounds of antibiotics don't work, going to something like tube surgery, many moms and dads are looking for an effective solution to hold off on surgery or multiple rounds of antibiotics to get to the root cause and stop the seemingly endless cycle of pain, sleepless nights, repeat infections, and one, two, three, four, or five courses of antibiotics, which in turn, if you watched the other video this week, we know is going to wreck your children's gut health and it's going to interfere with the way that their neuro, immuno, gastro, everything communication works. So I'm here today to tell you that natural remedies do exist. These natural remedies have been around for quite some time, and they will not only help your children reduce their pain levels, reduce those amount of sleepless nights because they're under so much stress and strain, and they help provide pain relief, they help reduce inflammation, they help promote drainage, and over time will not just work to get your child over the acute ear infection that they're experiencing, but will help prevent future ear infections as well. So moms and dads, if you are tired of seeing your child sick, in pain, under duress, ear infection here, antibiotic there, and you're worried not only about the short term, but also the long term effects of continued antibiotic use and ear tube surgery, then this is for you. We're going to uncover natural remedies today, talking about how we can help ear infections that your pediatrician may never have mentioned and that they often don't talk about. But they've been proven countless times again and again and again to help address the root cause. A few times a month, I do a phone consult with a parent who's concerned about ear tubes, antibiotics, tonsillectomy, adenectomy, because that is where the medical field has taken them after repeated ear infections again and again. Their kids are sick, their kids are uncomfortable, their kids are sad, their kids are crying, their kids aren't sleeping. Let me tell you, those conversations never get easy. And as a parent myself, the last thing I want is for my kid to be in pain, upset, up all night, and sick. The typical progression we see is the first ear infection, we get an antibiotic, it helps, goes away, and then another ear infection comes. Antibiotic again, another ear infection, antibiotic again. And what seems to happen is, while they still work, they get less and less effective over time, which brings us to the next referral. Pediatrician will say, you know what, maybe you should go see an ENT, where the sequence of events then goes to, well, we could do tubes in the ears. We should also really look at those tonsils and adenoids, talk about removing those so we can open up the airway and help your child breathe a little bit better. From a physical standpoint, will scraping the inside of the tissue out open the airway up? The answer is yes, it will in the short term. But what are we doing in the long term? You're going to create scar tissue in those areas. And also, tonsils and adenoids are part of the immune system, and they're there for a reason. When we remove them, we're essentially cutting out some of the first physical barrier of our immune system. So when we can catch this in process, and a parent may have been referred to that ENT, they may have had the first consult, they may have been given this is the surgery thing that we're going to do, and they just say, stop, we can make a huge difference in that child, family, and parent's life by getting this situation under control. So in order to understand natural remedies in ear infections, we have to understand the root causes of why ear infections occur. And it all starts with what we call plumbing. And we're not talking about that backed up toilet that you're really dreading having to plunge. We're talking about the drainage system of the inner ear. The number one cause of ear infections is a buildup of fluid. The ear, nose, throat, the respiratory system, and the lymphatic system work just like the plumbing of your house. All of that plumbing is linked together. So not only do the nerves and the smooth muscle of the inner ear need to be functioning as they should to push that fluid along for drainage, it's also got to move through the neck, the lymphatic system, and the entire body. Put simply, if our body can't get rid of those viruses and bacteria that tend to build up from the fluid buildup within the inner ear, if the fluid continually builds up and festers, then that bacteria or virus is going to replicate and replicate and replicate. And that's how we have these continual chronic ear infections. It's going to cause chronic congestion, leading to chronic inflammation and recurrent chronic ear infections, along with a host of other illnesses. Therefore, when we're talking about natural remedies for this plumbing system, there are things that naturally get this system in gear, things that address the poor drainage and get things moving. Just like a clogged toilet or a clogged drain in your house can back up and cause a bunch of crud, that's essentially what's going on inside your child's inner ear. So, again, if we have natural remedies that support the drainage and the movement of this fluid from the inner ear into the lymphatic system so it can get absorbed and expelled throughout the body, then those things are going to help. Along with things like naturopathic ear drops, which will help to dry things up, we can also look at things like changing sleep positions, moving around. One thing that I always tell parents when we're talking about ear infections is there's some very light massage work that you can do as a parent that is very helpful in this situation. The way we do it, take a washcloth, warm it up, and start with a warm compress. The area or the target that you're looking for, if you look at the outside of their ear where you see the hole that goes in, you want to come down from there. You're going to feel the back part of their jaw. And if you move backwards, you're going to feel a bony bump that's part of the back of the skull. Now, in between, you'll feel a little dip and soft tissue. That's our target area. With just a little bit of pressure, we're going to move downward, and there's a muscle on the front part of the neck that attaches that bony bump down to the front of the collarbone. We want to stay in front of that. And all you're going to do is just nice, easy strokes downward. This will help to open up the soft tissue. And if there's occlusion there, the distraction of that eustachian tube will help to drain it out. Now, this is something that you're going to have to do multiple times again and again if we're not looking at why the eustachian tube is occluded. But that brings us to our next thing. Obviously, if you're watching this video, you know what I do. I'm a neurologically focused pediatric chiropractor. And when we're talking about occlusion of the eustachian tubes, we know that misalignment of the upper part of the cervical spine can directly displace soft tissue and put pressure on the eustachian tube, that drainage tube, and affect the way that we can properly drain fluid from the inner part of the ear. So by making sure that structurally and mobility-wise, that upper part of the cervical spine functions like it should, it does two things. Number one, removes that occlusion, that interference, that irritation on the soft tissue. And number two, from the nervous system perspective, the nerves that are supplying that area, that are telling the smooth muscle within that part of the canal to contract and be constricted because they're irritated and they're inflamed, well, that pathway works better. We can have relaxation through there. We can have better drainage. So on top of things like a natural drop or the warm compress and the massage, making sure that this, from a structural perspective, is doing what it needs to do, making sure that the upper part of the cervical spine is A-OK, is right up there at the top of the list. So find yourself a neurologically focused pediatric chiropractor, somebody whose practice is devoted to serving kids and families. The next question we need to ask is, how do we know when neurologically focused pediatric chiropractic is going to be helpful in a case like this? Well, it all starts to getting a good understanding of what is going on with your child's history. Knowing a case forwards and backwards, from conception to where they are at, having a good understanding of how their development has gone, gives us a ton of insight. When we combine that with our insight scans, which measure which part of the nervous system is experiencing the most stress, tension, irritation, interference, subluxation, whatever you want to call it, we can also look at how our body is interpreting that information and how we are controlling the smooth muscle, the stabilizer muscle, the parts of our body that we can't control, but our body controls for us, where that energy is being put. And ultimately, we can look at the balance between that stress stuck on sympathetic nervous system, go, 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 fight, 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 and the parasympathetic nervous system, which is the rest, digest, sleep, immune function, the place where we want to see our kids. If we have an imbalance there, if everything else is thrown off, it gives us a pinpoint address location that we need to be addressing in order to take care of this. So what you see before you are two SEMG, surface electromyography scans, which look at muscle activity under the skin to tell us what is the soft tissue muscle stabilization doing throughout the cervical spine of this little boy here. Now, we have a before on the left and a progress on the right. Keep in mind that this is progress. This is not finished. This was his first progress exam. But essentially on the left side, you see a sea of red. Now, when we see large bars of red like this, it means that the body is in a state of duress. The way that it is interpreting sensory information coming in is not going very well. and it's outputting a whole lot of stress and tension. If we look up at the neck, part above the shoulders, under the head there, we see on that left side that we see a lot of red bars. Right side, we got a couple more red bars. When we move over to our progress exam, we can see that there are areas where we now see green bars, white bars, and blue bars, which are of much less severity than big red bars. What does it all mean? It means that as we've gone through taking care of this child's nervous system, the amount of strain, the amount of tight musculature, the amount of clogging things up that we see has decreased. What does this look like in real time? Well, from an objective perspective, cool. We see numbers, we see lines, we see bars. But in real life, we see subjective things. We see a little boy who's not suffering from chronic ear infections. We see a little boy who's not stuck having antibiotic after antibiotic, which is leading to diarrhea and upset stomachs. In real life, we see a little boy who's not going to be dealing with the long-term effects of having a tonsillectomy, adenectomy, tympanostomy, or any of that medical jargon stuff. We see a happy child and an even happier mom who's reporting that her little one is no longer congested, clogged, or filled with fluid in the ears, nose, and throat. We have a child who has kicked the sick. We have a mom who is full of confidence, and that is how we help families. So if you're concerned about your child who is dealing with sickness again and again and again, and it's gone from an acute phase to more of a chronic phase, we're looking at chronic congestion, chronic trouble breathing, chronic fluid in the ears, chronic ear infections, chronic crud. If you're ready to kick the sick, we're ready to help. You can hop on our website. You can get a 15-minute phone consultation completely free of charge to see if we're the right fit for you and your family. If you're ready to kick my door down, jump to the front of the line, give us a call, shoot us a message on here, get in touch with us. It's my goal to be accessible. We're open late. We're here to help you. We're here to help your family. Can't wait to meet you. Can't wait to see you. I'll talk to you soon. Take care.